Let's play a quick game of true or false, and the subject matter is endometriosis. True or false, there's an increasing incidence of endometriosis. Answer is false. There's no evidence that really suggests that there's an increasing amount of endometriosis. Now, there's one theory that surgeons are getting better at identifying endometriosis on laparoscopy and finding areas of it and getting biopsies of it, but there's nothing that suggests that it's actually increasing in incidence. True or false, family history of a relative with endometriosis increases someone's risk of having endometriosis. That one is true. There's a 7 to 10-fold increase in endometriosis prevalence in someone who has a first-degree relative who has endometriosis. There's also a significant correlation in twin studies of monozygotic twins both having endometriosis. True or false, endometriosis can be anywhere in the body. That one is true, which is interesting. So we think of it generally being in the pelvis and the abdomen, but it can be most anywhere in the body. And although the majority of the time we do see it in the pelvis, we see it on the peritoneum, it can get into the bladder, it can get into the bowel, it can be up in the thorax. I've heard of it being in the eye. And what can be interesting is during a patient like that, when they're having their menstrual cycle, they will sometimes have coughing up of blood because of the endometriosis lesions in the lung. I've heard of bloody tears because of endometriosis in the eye, and then bowel and bladder effects from having that endometriosis more active during that patient's period. True or false, there is a test to see if you have endometriosis. And this one is false. There is not a test for endometriosis. I'm asked this all the time, but there is no blood test or imaging study that can confirm endometriosis. Endometriosis is only diagnosed by having surgery, so usually a laparoscopy where we put a camera in your belly and obtaining a sample of the endometriosis that's seen, which is then confirmed by a pathologist. True or false, surgery for endometriosis increases their fertility potential. This one is a soft yes. It's yes, but the degree to which it is a yes is undetermined. It's estimated that we would need to do 48 surgeries for endometriosis and infertility to get one additional pregnancy. So although yes, it helps, it doesn't seem to help by a lot. True or false, you can still have symptoms of endometriosis after having a total hysterectomy and your fallopian tubes and ovaries removed. This one is true. About 15% of patients, especially those who have deeper, more infiltrating endometriosis, will still have symptoms after having a total hysterectomy and their fallopian tubes and ovaries removed. True or false, endometriosis causes infertility. This one is true. Endometriosis can cause infertility by multiple different factors, including affecting the sperm DNA, affecting the ovaries and the oocytes or the eggs, and in cases of adhesive disease, causing obstructions and adhesions in the fallopian tubes, preventing meeting up of the egg and the sperm. True or false, the more endometriosis you have, the worse the symptoms. This one is false. There's actually not found to be a direct correlation by how much endometriosis is seen, like on a laparoscopy or looking in the abdomen. The amount that's there doesn't necessarily correlate with how severe the symptoms are. True or false, there's no cure or treatment for endometriosis. That is definitely false. We have all types of treatment options for endometriosis. If you're someone who's having chronic pelvic pain, severe pain with period cramps, or pain with intercourse, you should talk to your doctor about possibly having endometriosis and see what options are available for you.